lunch break. Good to see so many of you. How's the energy level? Good. That sounds great. So as the market evolves, as you all know, so do the models used to reach customers. The next discussion, very interesting topic, looks at how new care and commercialization models are expanding reach and actually creating value across the ecosystem. And I'm very excited to welcome our moderator, Candice Goodwin, to the stage, who will be joined by Steve Shell, Peggy Plains, and Angelo Gatto. Welcome on stage, everyone.
Everybody, thank you so much for joining us late on the last day. We really appreciate it. We don't have much time, so we're going to dive right into it. I'm going to go ahead and kick us off with our esteemed panelists. I'm going to do a quick intro to keep it nice and brief. So we're really excited about the folks we have here. There's some senior leaders that have had a lot of great experience in their careers, and I'm going to kick off with Steve Shell, president of MWI Animal Health. He's led across pharma, insurance, and distribution, from senior roles at Merck and Pfizer to helping scale Fetch. Today, he leads MWI Animal Health at a moment of significant industry. I would say it's consolidation, but it's not just about consolidation. It's really about advancement. And so really excited to then move on to our next panelist, Angelo Gatto, CEO of Chanel Pharma, one of the world's largest manufacturers of generic and private labeled animal health medicines, supplying partners in over 80 countries. And he brings more than 25 years of global pharmaceutical leadership with senior roles at Johnson & Johnson, Pfizer, and Nueva Group. And I'm not even going to say the last ones. And we'll move on to Peggy Plains, founder and CEO of My Lady Bird. And she works at the intersection of pet care, health, and I'm like reading, small notes, advising founders, investors, and leaders on go-to-market strategy, ecosystems, and transactional readiness. So let's go ahead and dive in. There's a lot to talk about. There's a lot of change happening in the industry. So let's talk about that change. Steve, we're going to kick off with you. The market has gotten very noisy in a variety of ways, and I think we're going to dive into what that noise looks like. But let's start with you, Steve, about your experience. You've been in the industry a very long time. What's making the market so noisy right now?
So I think in the last couple of years, especially just coming out of COVID, where we had a really great experience with fast growth, invoices were growing. A lot of pets were coming in for treatment. In the last 3 years, we've actually seen that moderate. 5 years ago, we were trying to talk to veterinarians about boosting client traffic and increasing compliance rates, and they would say, no, I don't need more clients. I need more vets. I need more capacity. Now it's about trying to draw pet owners back into the practice, trying to boost care, and we're having a lot more discussions around access to care and affordability. So that's been, a lot of the noise most recently. There's a lot of things happening in the market with, some proliferation of marketplaces. We're going to talk about that a little bit as we see some new wholesale marketplaces coming to market. Very rapid growth in retail. That's actually the fastest growing part of our business as a distributor, as more manufacturers are trying to get access to that exploding area of growth in retail. Our veterinary space continues to grow, but at a much slower pace, and we have to help our vendor customers get access to their customers where they're showing up, and in more cases that's happening in e-commerce and in retail. So we want to make sure that we're helping suppliers get access to those customers in those channels.
Awesome. Thank you. And I realized I did not do a proper intro. Outlier Advisors, growth strategy consultants who've worked on all sides of the business, including retail. So excited to talk more about that retail shift. So Angelo, how, as a provider into the space who works with partners and B2B partners specifically, how does this impact your changes about how you work with partners?
Yeah, very, very good question, in my opinion, to Chanel, because actually we are partners working together since a number of years. Chanel is an historic generic player. Mm-hmm. Which is now repurposing, refocusing, and the core of the strategy of Chanel is B2B. And we have some historic business as B2B for private label in the UK and potentially expanding beyond that. So these examples that Steve I've mentioned are absolutely instrumental for our future strategy. Mm-hmm. So we are less and less focusing on our B2C, and we are focusing more towards global markets, because they have, in our view, more potential, and there is a gap in this global markets in terms of having somebody that is focused on B2B. So it's very easy to find a veterinary company, but it's so difficult to have somebody supporting the front end where the products are commercialized. We cannot be good in everything, so we are good in developing and supplying products, manufacturing and supply. Steve is good in commercializing, so this is why there is a perfect match. It's what we have announced in this TISACO event in Boston last year. In May, we were talking about where I spoke about portfolio filling and portfolio building. That's the strategy. So we tend to work on the future portfolios of our partners.
Very nice. I think that fits right nicely into the.
I would just add, Candace, to that I failed to say this in my comments, but one of the ways that we're addressing access to care is with private label brands and with generics. As more of those come to market, it's part of answering the access to care for a pet owner. A veterinarian can offer a slightly lower price for the bioequivalent product to a branded product. So it lowers that barrier to entry for care for a pet owner, but also increases margin to the veterinary practice. So that's an area where we're partnering with companies like Chanel.
Yeah, no, I think access to care is such a hot topic, and there's certainly a lot going on in that arena. Again, we have lots of changes. Peggy, I'm gonna move over to you. I know, as we prepped, there's many different ways we see the market moving and changing. But do you want to talk a little bit about some of, Steve's comment about retail and these ordering platforms?
Absolutely, yeah. So thank you, Candace. And building on what the gentlemen, both of them just said, it's very interesting because what we're seeing as manufacturers moving into, distribution themselves, they've kind of interrupted the whole full chain of, also the role of distributors has kind of changed very much like that. So as they're building consumer pull, map pricing, and mind you, for all the Europeans here, that's not something we know in Europe, but that's something we know in the US. So minimum advertised price has actually held that chain together really nicely. That is a stabilizing factor. We don't see that in Europe, but we saw some of the companies doing that very successfully. For example, Zoetis, who built, a consumer pull around some of their pharmaceuticals, and basically the consumer then moving into a practice and asking for that pharmaceutical, and the distributors still had that margin. Where you see a very contrarian picture is flea and tick products, without mentioning names here, where, they weren't able to use MAP as a stabilizing factor because it was not consistently enforced, and that basically kind of diluted the whole value chain for them. So I think there is the commercial journey today is a very big factor of enterprise value. And as we move through the motion and through ecosystems like, for example, Chewy, who have started to enter the veterinary market, that's exactly what we have to look into: consistency and reach.
Yeah, I think there's been, I call it really a convergence. We went through this consolidation cycle where we had, more and more of like the similar entities come together. And now with this convergence where Chewy is no longer just a retailer.
Yeah.
Right now they have the veterinary clinics as well. My former employer, Petco, similar kind of convergence, and certainly Zoetis and others in the room also. So again, back to the noisy landscape we talked about when we started. Steve, how does this really impact that commercial journey? As you think about, some of these startup founders out here thinking about bringing their products to market, talk a little bit about what that means for them.
Yeah, I think it's important that you are thinking about commercial partners that can give you access to all those channels. You really have to be thinking about it as an omni-market now approach to the marketplace. It's not just through the veterinarian. The veterinarian still is the trusted advisor for the health of the pet, but pet owners are showing up in so many other places to get care for the pet. And manufacturers, innovators need to be there. You need to be prepared to show up there. So we've built our business model around helping manufacturers and innovators do that. Last week, we announced this partnership with Gallant. We've been talking with Gallant for several years. We were brought into that conversation really early, recognizing some special needs that they had. So we helped them build the capability. We're actually building the capability, but based on the fact that that's going to be a very important way that they get to market. So we're an important commercial partner for them based on some new capabilities. With other partners, it might be some combination of our veterinary business and our retail business. Some manufacturers go directly to retailers. Some of them come to us, and some that go direct to certain retailers come through us for other retailers because we have the relationship. I'll give an example of Costco, where Costco is a relationship that we have. They want weekly delivery in one box or one order against one PO and processing one invoice. So even the big names that you see on the marquees up here, while they might be direct with certain retailers, they actually come through MWI to Costco because Costco wants the efficiency that we provide by weekly orders, weekly deliveries, and just that smoothed out ordering process.
It's a really great point. I'm going to go off script for a minute. How many in the audience actually do business in the U.S. today? Can you raise your hand? So quite a few, but there's a lot that don't. And I think that what we have seen is a really big shift in the U.S. really over the last 12 to 18 months, I would say, where retail has had a more meaningful presence. And we see a lot of changes around that. So as you think about, your future journeys, if you're coming to U.S., it is really important that you think about this on the market change that's happening because Costco is a great example, right?
Yep.
They're a major retailer that has a significant presence in the pet medication space.
I would say it's true in our UK business too, and some of the services that we provide that just help innovators get to the market. We've set up a pharmacy business that does home delivery pharmacy for many of the wellness platforms in the UK market. We've got relationships with several of the large consolidators in addition to a sizable independent business. We run the largest GPO in the UK market. So there are a lot of ways that we're trying to serve the market to create access for new innovation, new technology. So veterinarians can ultimately access the product, and pet owners and producers, right? I'm talking a lot about companion animal here, but a big part of our business is actually food animal. In the U.S., it represents 35% of our total business, a little bit less than that in the U.K., but we've got a direct-to-farm model in the U.K., too, to ensure that we're creating routes to market because ultimately we're trying to deliver medications to patients.
No, I think that's great. Talking really about getting that innovation into the hands of the veterinarian and the consumer. There's lots of ways you can demonstrate that you're having traction from an investor thesis. And so, Peggy, this is your wheelhouse. So can you talk a little bit about, the difference of real traction versus maybe some, excitement they're seeing, but not traction?
Yes. I always, I have to say, I always say, the launch can be bought. So the first, launch can be bought, but re-purchase is earned. So for me, that's a big difference. So what we have to look into is, does it need a rep to go repeatedly somewhere to get the job done? Then that means it's a rep dependent product. Or is it the vet able to displace the new product with something he used to trust? That means there's trust there. So that was built. So that's traction versus just noise. In my opinion, noise today is not relevant because it's definitely not lasting. And the other indication, and that's something very related to what you know very well, Steve, is if you have a product which is very driven by promo through a distributor, that's noise. That is not traction. So for me, that's the differentiator here. It's really about the repeat purchase and the customer retention. And I think the repeat purchase rate is the data we have to look into always.
I think that's great. I think one of the challenges we've had, again, in the veterinary space is lack of data and the ability to really see that end user repurchase rate, right? Not just selling into the veterinarian, but also actually out to the consumer as well, which is where retail gets a little more interesting, for sure. So we'll move on, Angelo. So as you think about, all of this complexity and change, obviously you're a major manufacturer, you have exciting products coming to market. What do you have to think about differently? I know we talked a little bit about partnership, but can you talk a little bit more about why that's important in today's environment and maybe talk about the relationship with MWI?
Yes. It's a question which might require some time to answer in a comprehensive way. So I try to take just one perspective, because, so first of all, innovation in the animal health has a certain challenge because of the economy of scale, the fragmentation of the market. So it's not that simple. So it's complicating, and also products are more and more sophisticated, more difficult formulations, technologies behind. So what has worked in the past? Chanel is a good example. Somebody decided to start from scratch in 40 years. It was a successful generic players. That would not work today. Okay, so you need to be by far more focused and choose the field of play. and focusing on what you can be better than others in what you choose, and look for partners. So we spoke about working together in private label, but we also spoke about how there is more need of innovation. So even if in countries as big as US, where NWI is a massive player in this private label, we discuss about innovation, and we cannot be strong in everything. So we need to bring innovation with partnership. So I like to mention examples. Again, in the Boston event last year, we met a Korean startup. And now we are working with the startup to bring their product to US and to Europe, where we co-create. We are doing all the development. We will do the manufacturing. So this is a perfect place where to find startups which are very strong in early innovation, but they miss the capabilities to develop and formulate products. And that is where we, as Chanel, we enter with our resources. We have more than 100 R&D guys, and this is where we are strong in playing with. And so with a startup, we partner for the innovation. Then we go to Steve, and he will commercialize. So it's like 3 pillars, no? The pure innovation, the development, manufacturing, and then the commercialization. So I try to simplify a lot, but there's a complex value chain, I would say.
I think you did a great job of simplifying it. And I think it does really speak to the complexity of the market. And we're just doing one market now, not, global stage. I mean, there's that type of complexity across, every market you're going to enter. As well. So I think it's a really good example. And I like the way you frame that. I think that's something we can all think about. We use Playing to Win, the strategy framework. And I also like that you, kind of put out there how do you win in each of these markets. And it really is through making those choices about where to play. And then who to partner with. So I think that's great. From there, Peggy, let's talk about, how that pulls down for products like, Angel's creating or originator drugs, as well. So talk a little bit about, how you see the differences of those folks bringing the new products like Gallant, great example, to the market versus, some products like, Chanel's bringing forward.
Yeah, I want to start with saying no matter how exciting the science, one thing, in my opinion, always applies. You have to show it works before you scale. So, and I think especially with innovative products like, like the ones we're talking about just now, is how does that fit into the flow of the veterinarian? How do you support? And that's the moment where a new category like that needs more support within the veterinarian. Support meaning how much can I charge? How does it actually work? How does it work? How do I build it into my workflow? What do I do if it doesn't work? So I think this is where we have to focus in those new categories to really still, that's a place where we have to take the veterinarian by the hand. I think that is one of the crucial matters. And then on the other hand side, and in that scope is don't rush it. So, it's not about doing it. Again, we're back to the noise, right? It's not about making this massive, wide launch. It's about, find your 10, 15, 20 key opinion leaders, build it in depth, and multiply it from there. That's how I do see that.
I love that so much. It's great. We got a chance to meet for this panel, and it's always fun when you meet somebody who has a very, very similar approach to bringing innovation to market. So I couldn't have said it better myself. It's fascinating when we are so aligned. And I think it's important. It really is not about a moment. I think that there is a change in how we are all consuming information. So this ability to kind of breadcrumb it, as I call it, out and kind of let it catch fire versus kind of, do a big launch at VMX. If you guys remember back in the day, we'd have a big veterinary conference and everybody would think I've got to launch it there. But I think the way you described it is much more modern, I would say, as well. So we're going to move on to, again, we know the three ways you think about it, but let's talk about kind of that third, right? The partnership strategy. And it used to be enough that you could kind of, maybe go it alone, but it is obviously very complex. So as we think about the need for partnerships and ecosystem, I know, Peggy, that's one of your favorite words. Let's talk a little bit about how distribution, is maybe more important than it used to be, which, again, when we think about these ordering platforms and ways that the market has changed, just walk us through a little bit about, where you see distribution playing a role and maybe where in the past it hasn't been as successful, but really those lessons and how you're thinking about it today, Steve.
Yeah, when we're most successful when partners come to us pretty early in their commercialization journey so that we can help kind of guide them on all the abilities to access the market. In addition to our reps, we have more than 500 people that are touching customers every day. We've got about 10,000 touch points a day in person with some demand generator from MWI, whether that's a rep in the field or it's a customer service agent or what we call inside sales or remote sale. That's an important and a very expensive part of our portfolio. But in addition to that, we've got demand generation, digital demand generation tools, B2B tools, B2B2C tools. So it's about pulling it all the way through the veterinary practice to the pet owner. I think that's a really important part of what we offer. So starting early, I think, is really important. When we don't get that early view and people just come in and say, I really just, want to get to the vet, right? We're just not quite as successful there as when we start early in the journey, like we did with Lindette Gallant. And we've had several conversations with some emerging partners here, that were in the early part of the process. I think that's just a really critical piece of it so that we can use those elements of the strategy and then phase that launch, as you said, right? So sometimes it start with one and then you start to build on that over time to build the sustainability and along the journey. So, but I think it's really start early, understand the customer. We can help do that if you come in early. There's some access that we can give to better understand the customer. It's obvious that you've already done that and in the product design, but as we prepare for the commercialization journey, we just want to make sure that we're hitting the critical positioning points that are going to help us achieve the early penetration, but ultimately adoption.
That's super important. I do think that early is so important, especially with innovator and originator drugs. I think that it's you need that time, right, to make sure the market's developed appropriately. Any advice, I guess, this is a new question for you, but I'm sure there's lots of startups out there. How is it best for startups to engage with MWI and others to kind of have those conversations besides events like this, which are fabulous?
Yeah, I've had people walk up to me here and just say, hey, Steve, how's it going? And one told me that they've already been introduced to our company and there's an NDA floating around in MWI. Some might have no idea. So they find their way. That's really good. That's part of why we come here. There are 4 of us here on this trip. Actually, one joined today from our UK team. So there are 5 of us. So you can approach us right here. Approach us kind of in real time where we tend to be very accessible on email. And you can reach out to a lot of people that know us, know what our capabilities are. But we're always open to innovation. We really, I think we thrive in that space. And frankly, even in the private label space, things that there's still innovation in spite of the fact that they're bioequivalent product. By definition, they're equal to the originator. There's still innovation there through packaging, through SKU, size, pack size, those kinds of things. We can help guide that because we're really close to producers. We're really close to the end user. So I think that's a really important part of, what we add. So I would say just approach us either directly in person or virtually.
No, that's helpful. And then, so speaking of tying back to Angela, let's talk about, private label and the approach there as you thought about partnerships. So what does real partnership look like to you, right? Because I think there's a lot of different ways we define partnerships, but what does a real partnership look as you think about, scaling your business worldwide?
First of all, B2B is by definition, or by definition implies partnership. And in order the partnership to work, there is need to trust to each other, and is a prerequisite to have reliability in this relationship. So I think that especially in the last few years, I would say the last 6 years, the animal health, not only, but the animal health has suffered about disruption, and so reliability of supply is fundamental. And of course, reliability of deliverables in case it's not yet a supply, like development milestones on, is very important because, time to market is making a difference. There is a number of of patents, especially in the parasiticides that are coming in a few years. We are very busy with that, and we are very careful in the selection of the partners. Okay, and vice versa. We want to make sure that our partners understand our reliability. Is important projects require significant investments, dedicated area to manufacture. Those are normally involving technologies, bulky soft chews, which are not so easy to manufacture. Is coming back to my previous answer, the complexity of certain formulations and products is definitely higher than what used to be in the past. And so this means that you need to be right first time, and you need to be, very strong in managing those projects. It's not a project you can manage with the left hand if you write with the right hand. So, and I think one important element is long-term reliability of supply in terms of, U.S. now is generating a bit of uncertainties in terms of where to manufacture. And so there is a tendency to go, okay, but then we need to launch products in the U.S. for U.S. But this is, for animal health is a big challenge, because the economy of scale of the animal health products do not justify that you have an investment in U.S. and Europe. And it's so difficult to get a European supply from US. Okay, so just to give a couple of examples how when you sit together for a partnership, you need to have really a long-term perspective covering all the value chain end to end.
I think that makes a lot of sense. And I definitely think that I've seen a lot of partnerships not be successful. I'm sure you guys have in your careers as well. And I think it all starts with, the relationship, but also the co-creation of value.
Exactly.
Think about how you're going to, get the supply where you need it to be, because at the end of the day, that's super important, the demand planning, I'm sure, from both sides. So thank you. It's a great example. And so I think, talking about demand generation, I'm gonna move it back to you, Peggy, because I think, there's sales in and there's sales out, right? And so, Steve, I think when you mentioned earlier, somebody like a Gallant, right? Like, how do you make sure that you're starting early and you're creating demand in the marketplace? And there's a lot of nuance to that. So Peggy, this is a little bit of your specialty. Can you talk a little bit about, the demand creation?
Yeah, I'm very passionate about that, because for me, demand creation as such has to sit with a brand. And building on what you said, Steve, before, I think there is a fantastic opportunity as a brand to collaborate with a distributor who potentially knows the market, inside out much better. But it's really that relationship which can help you and support you. And as a brand owner, that actually creates massive value and traction. So if you own your demand, that's also what will pay you the multiples in the end, to be very specific. So as a brand, you have, I think, that threefold you have to serve. You have to serve the clinic. I spoke about that before. You really have to explain to the veterinarian how to work the product, why it works. So you have to really do that part. You also have to talk to the consumer. So the ones who really don't use the direct to consumer kind of relationship, they're losing a big lever in terms of multiple. And then, of course, acquisition goes through, it has a premium when you own your demand. And a distributor has millions of products, distributes millions of products, thousands of products. They will amplify what you're doing for your brand, but they're not able to solely build your brand, because you're delegating the most difficult part, which is, creating that market for you to a distributor. And that typically is, in today's world, close to impossible, in my opinion.
Yeah, no, we firmly agree on that point. And I think the same is true for retail, right? Having worked at a major retailer, you can't just bring a brand and hope they'll sell it out the door. You really do have to know your consumer, make sure you have great products, and communicate that out in the marketplace ahead of time. And I think that's true in this channel as well. So we're almost at the end of the session. So we'll do kind of a quick fire around the room here. As we look at, one thing that needs to maybe be thrown out with the old playbook, as we're thinking about this new, new normal we're all living in. Is there anything you have words of wisdom? I'll start here with you, Angela. Is there anything you want to let the audience know about how they might think differently about bringing new products to market?
I think maybe I can be very quick, because I see we don't have time.
Yes.
You need to be very focused.
I love it. Very focused.
Because what worked in the past, do a bit of everything and being good and everything is not gonna fly. So very focused.
Perfect. Very focused. Moving on.
I would say one of the biggest changes is that you have to think about the ultimate end user in the case of the pet owner or in the case of the producer.
Mm-hmm.
The old playbook said you have to go through the vet, right? The vet was a gatekeeper. The vet is the trusted. I think we have to, and they'll remain that. And we were founded by a vet 50 years ago. We're very much a vet focused company. You have to be thinking about the pet owner. You have to be thinking about the producer, and you got to find routes to market based on the way people are buying differently today.
I love that. Peggy?
I have a very simple one. Be in love with your customer, not with your product.
I love that. I think that is great advice. And I think, that really, everyone in this room, I hope you've taken away something about bringing innovation to market. It's more complex, but we're more excited than ever that we think there's just unlimited potential if you get it right and find great partners. So, we'll finish 30 seconds early, and thank you all. Appreciate the panel so much.
Thank you.